Hello there, Dr. Salvatore Maleka here again. The topic of discussion today is going to be Achilles tendinitis. Thankfully to great mentors in my training, I discovered that there are specifically two types of Achilles tendinitis, and it's very important to distinguish between the two because the treatments can very well differ. Maybe not from a conservative standpoint, but definitely from a surgical standpoint. Nevertheless, the two types of Achilles tendinitis that exist are insertional versus non-insertional. And I can definitely show you what that looks like in the form of a picture here. Also, I can demonstrate this to you in the office, what insertional versus non-insertional looks like. Neither here nor there, non-insertional Achilles tendinitis, which is what we'll start with, more often than not, definitely more often than not, and has a high success rate of becoming alleviated with conservative treatment or management. The few forms of or modalities of treatment for non-insertional Achilles tendinitis are obviously, anti-inflammatories, whether that's gel or oral. I don't typically love to give all my patients, anti-inflammatory pills. There are definitely more natural anti-inflammatories out there, such as turmeric, that don't kill your stomach, for lack of a better way to put it. But, if you're the right patient for it, I can give NSAIDs or Tylenol, whichever one might work best for whichever patient. However, the most important and the crux of treating Achilles tendinitis, even whether it's insertional or non-insertional, for conservative treatment, is stretching and strengthening of the tendon. You can do that by yourself. You can do that with physical therapy. I like to prescribe my patients physical therapy so that they can get better and actually have more modalities from a physical therapy standpoint thrown at this ailment. The other is a night splint. I do like to prescribe my patients night splints because the night splints can help keep your Achilles tendon in a non-contracted position. I do not like heel lifts because heel lifts will keep your tendon in a contracted position, which is what we don't want. But non-insertional Achilles tendinitis classically and typically gets better with conservative management. There is the other form of Achilles tendinitis, which is insertional Achilles tendinitis, which still can get better with conservative treatment. However, the odds are lower when compared to non-insertional Achilles tendinitis to get better with conservative treatment. If your insertional Achilles tendinitis does not respond to conservative treatment, then fortunately there is a minimally invasive technique called the Zadig osteotomy that actually my mentor in residency showed me how to do. It is a very, very tiny incision. You go through that small incision and you make a cut in the heel bone that realigns the biomechanics of the Achilles tendon to essentially take a little bit of tension off of that tendon so that you can still have the strength of the Achilles tendon and that's not compromised, while at the same time relieving a little bit of that tension, if that makes sense. Definitely look at the article that I posted below. Definitely look at YouTube videos of what that Zadig osteotomy is, and I'm more than happy to help you with any form of Achilles tendinitis that you might have. Conservative treatment, let me not forget, conservative treatment for Achilles tendinitis insertional is the same as non-insertional. The only thing that differs between the two is the surgical treatment. Hope you enjoyed this video and hope you felt educated. If you have any questions, feel free to let me know. Come visit me in my office and I'd be more than happy to help you in any way that I can. Thank you.